as we're going. But thank you everyone for joining the webinar today. We're excited to kick off another webinar with O'Neill Marketing. And before I start, I'll give a little brief introduction of myself. My name's Hannah, and I lead our partnerships team here at Savvy. Cyril, who is our co-founder and CEO, might also join the call later. So if you see his name or if he chimes in for any questions, that is who that is. But we'll go ahead and get started. Today, we'll kind of just cover the I'll highlight the 4 key areas that we'll be covering. First, we'll be looking at an ICHRA overview. Second, discussing the trends on the individual market. And then 3, we'll be highlighting how Savvy works with employers to help administer ICHRAs. And then lastly, we'll be walking through how you can become a Savvy broker partner. We'll also leave room at the end for any Q&As. But before we kind of start with this agenda, would love to get a sense of what everyone's experience with ICHRA is. So for everyone who's on the call, if you can use kind of that Zoom raise your hand feature or just talk or add the chat feature, we'll let us see a raise of hands of everyone who has put a client on an ICHRA to date.
How do we do that?
There should be a raise your hand feature within Zoom. So if you look over at the more section, it should say raise your hand.
Oh, got it.
To kind of indicate who. All
Thanks.
Right. Yeah. All right. So a few people, it looks like. Okay, great. So it looks like we have a few brokers who are familiar with it or at least put a client on it. So given everyone's experience a little bit different, we'll make the webinar more conversational so that you guys can really make sure that your questions are being answered. So feel free as I go to stop and ask questions. Again, everyone should be unmuted, but you can also add them to the chat box or to the Q&A box, whatever is preferred. All right, so let's get started. Looking at ICHRA. So what is ICHRA? ICHRA is short for Individual Coverage Health Reimbursement Arrangement. You'll likely hear me refer to it as ICHRA as well. I tend to oscillate between the two, but ICHRA is a new benefit product that was introduced in 2020. Many of us have heard of HRAs and know that they're not new, but the ICHRA is a very specific type of HRA that was introduced January 1st of 2020. It allows employers of any size to set a tax-free budget or stipend and let their employees select or purchase their own individual ACA plans. In the figure below, you'll see how ICHRA compares to traditional group health plans. So with ICHRA, employers are setting a stipend that their employees can use to purchase any plan from any carrier, whereas with traditional group health, employers are choosing one carrier and often 1 to 2 plans within that carrier. So as you can imagine and probably tell, this model offers a lot of flexibilities for employers and employees alike. So I'll walk through some of those advantages here. So from an employer standpoint, ICHRA allows employers to reduce their health insurance costs through a fixed predictable stipend. They're also able to eliminate their risk and remove themselves from the business side of offering healthcare. They're able to decrease their administrative burden that's often associated with offering traditional group health plans. And for those groups under 50 that often deal with participation issues, they can say goodbye to those same participation requirements as well as those contribution requirements if they're under 50 employees. And then for large employers, ICHRA also satisfies the employer mandate as well. And then from an employee perspective, ICHRA provides them with more choice and control over their health plan decision-making. So they're able to decide how to use that stipend to pick the plan that works best for them. Additionally, the employee's medical plan is now portable. Since that plan is an individual plan, it's in their name and not tied to employment. So if they ever leave the company, they're able to continue their coverage in that particular plan. And then next, we just kind of want to highlight some of the employers and areas where we see employers that are more interested in ICHRA. So now that you've seen the advantages, have a little context on ICHRA, we'll dive deeper here. We found employers select ICHRA for a variety of reasons, ranging from their size and industry to their geographical location. From a size perspective, employers with as few as one W-2 employee can set up an ICHRA. So it makes it a great fit for those small and mid-sized businesses and their brokers who have struggled finding coverage historically for them due to things like size, participation rates, and contribution requirements. And then we've also seen ICHRA take off for larger employers that have experienced high renewal rates. Unlike traditional group plans, individual plans are actually community rated, not risk rated. So employers who may have seen high renewal rates the year after they set up a plan due to one or two sick claimants, if they move to an ICHRA, they're able to really reduce that spend given the plans are community rated. And then from an industry perspective, we've seen a variety of industries be interested in ICHRA, but some of the characteristics that make a group more interested or an industry more interested are things like having a high turnover, a mix of lower paid workers, or a mix of employee types, given flexibility that an ICHRA offers for employers. This includes things like healthcare workers, retail workers. We've seen a lot of nonprofits as well be interested in ICHRA, and things like other things like staffing agencies, those sorts of industries. And then lastly, from a geographical standpoint, we've seen ICHRA take off in states where the individual market is less expensive than the small group market, given each state does vary in terms of how they operate their individual and small group markets. Sometimes some states are less expensive than others. We've also seen growth take off for companies who now have remote employees, because with an ICHRA, they're able to set a flat stipend and their employees can pick the plan that's best for them based on where they live. And then lastly, for this section, we just want to kind of highlight what the future of ICHRA looks like. So the ICHRA market has taken off in the past 2 years. Even more so in the past 6 to 12 months. And we don't see this growth stopping, but it's not just Savvy that feels this way. There are a number of signs pointing towards widespread adoption, both between the Department of Treasury and the Kaiser Family Foundation. So here, and this first kind of quote that we've shared on the left-hand side, you'll see the US Department of Treasury has recently updated their predictions, stating that now they're predicting around 43 million ICHRA users will be on an ICHRA by 2024. When ICHRA originally rolled out, they estimated closer to 10.9 million employees will be on an ICHRA. So as you can see, this is quite a jump in difference. And also this represents 1/3 of all employers or employees, which is a huge proportion of potential employees that would benefit from an ICHRA. And then on the right-hand side here, you can see a quote from the Kaiser Family Foundation. We have, they did a study this past year, surveying C-suite executives of 5,000 plus employee groups. From that survey, they found that 9 in 10 C-suite executives of 5,000 plus companies were planning to implement an ICHRA in the future, which speaks to the fact that ICHRA isn't just for smaller to mid-sized employers like was originally thought when it first rolled out, but there are also larger employers that are finding a good fit with ICHRA. So I'll pause there, see if there are any questions before moving on to the individual market overview section. So again, feel free to unmute yourself, ask questions, or add anything to the chat box.
Yes, I did have a question. My question was, you said that the employee could keep the insurance, the ICHRA, the ICHRA insurance after they were laid off or left of the company. What would be the difference? Like, would the plan change if the employee is no longer with the employer?
So the only difference if a company were to, or if an employee were to leave the company with their plan would be that they would now pay for that plan directly. So they wouldn't be receiving the stipend, but the plan itself would be the exact same. They would just be paying for the full price themselves versus having that employer stipend to put towards it.
Thank you.
Of course. Any other questions? Alrighty. Well, I'll go ahead and get started on the next section, but again, feel free to stop me as I'm going if anything pops up. So with ICHRA, you're now helping employers put their client or their employees on individual plans, which means it's important to really have an overview of what the individual market looks like. For many of you, you may already know this, so we'll keep it brief and just hit on a few kind of highlights as to why ICHRA is taking off and why it might be a good fit for some of your clients. So first we'll look at the carriers available on the individual market. So the carriers available not only drive the quality of the plans, but also the premiums. So here you can see the types of carriers that are available. For the exact type of carrier or the exact carriers in each market will vary state by state, but you can see that you get traditional carriers like that you see on the individual, on the group side, like Blue Cross, Kaiser, Cigna, United, some of those legacy carriers, as well as some carriers like Oscar and Bright and Ambiter that are specific to the individual market itself. And over time, we've actually seen the number of carriers present on the individual market increasing. You'll see here in 2017, the number of carriers or insurers or carriers by state. So the states with orange or yellow, they are states that have just one insurer in the state, whereas the blue and light blue represent states with 2 and then 3+ insurers per state/county. And comparing 2017 to 2019 or 2021, you'll see a significant jump in the number of carriers per county and state. So this influx in the number of carriers has not only given employees more options as it comes to the carriers they can choose and the plans they can choose, but it's also helped drive down cost. So this additional competition is helping drive down costs on the premium side. So looking specifically at those premiums, how much has the competition driven down costs since 2017? So here in this graph, you can see from 2017 to now what that change in premium looks like. There was a drastic drop off, and then over the past 4 years, we've seen a lot of stability in the individual market with premiums only changing by 1 to 2 percentage points, which is largely uncharacteristic of traditional group health plans. If anyone is more familiar with the group health side, you know that those renewal rates, especially recently, have often been in the double-digit category for renewals. So the stability and the low premiums has driven a lot of employers to ICHRA over the past few years. And then given the premiums do vary state by state, I want to kind of highlight how the exact premiums have changed state by state. Looking first at 2019, you can see here, blue represents states where the individual market is more expensive, whereas that yellow orange color represents states where the individual market is less expensive. So from this map, you can tell in many states, the individual market is still more expensive than the small group market. Whereas as we progress through 2020 and the coming years, you'll start seeing lighter blues and more yellow and orange. This year is 2020. And then 2021, again, continuing to see kind of that transition where the individual market is becoming less and less expensive, all the way to current of 2022, where we see many more states where that individual market is less expensive than the small group market. And this kind of speaks to that point earlier around some of those geographical trends we've seen from employers adopting ICHRA, where employers in certain states are adopting it due to these factors where the individual market is just less expensive. And then lastly, we want to look at the network types that are available on the individual market. So how do these networks compare? So on the individual market, again, the networks that are available will vary state by state, but they across states, there are EPO, PPO, HMO, and POS networks available. Depending on the states you sell in and what your preference is for selling, you'll want to make sure that the network types that you're looking for are available. EPO and HMO are definitely more common as it relates to network types on the individual market, but there are 23 states that have PPO or POS plans available in every county. Here you can see how this map looks, or how the network types look across the map. So this map is showing every state and county with a PPO or POS network. This is showing every state or county with an HMO network. And then lastly, every state or county with an EPO network. Within the context of an ICHRA, the network type becomes slightly less important given employees are picking the plan where their carriers are in network. But of course, with EPO and HMO plans, out of network benefits are often not there or much lower than on a PPO plan. So next, I'll pause there before kind of diving into some key differences with Savvy and see if there are any other questions. It looks like there is a chat question. So it says, does the employee lose their special enrollment period if they elect an ACA plan? I'm not quite sure what that's asking. Feel free to reiterate it, but I'll try to what I think you're asking here is, so ICHRA, when an employer sets up an ICHRA, that does create a special enrollment in period that allows employees to enroll in individual plans mid-year. So if an employer sets up an ICHRA today, for example, for May 1, their employees can still enroll in those individual plans, even though open enrollment is over for the individual market, since setting up that ICHRA is considered a special enrollment period. Are there any other questions kind of before I keep going? All right, great. So now that we've talked about ICHRA and the individual market at a high level, you might be wondering how an employer actually sets up and administers an ICHRA, who Savvy is. So we'll, in this section, highlight who Savvy is and how we help employer and brokers administer ICHRA and what that experience looks like. So first, looking at kind of who is Savvy and what is our market differentiation. So Savvy, we are the leading ICHRA platform for brokers and employers. Where we stand apart in the market is in a few different categories. One, our modern technology. So Savvy is based in Silicon Valley and has the leading technology available for ICHRA administration to make both the experience seamless and more automated for employers and brokers, as well as the employees that are selecting their plans. Savvy also offers end-to-end administration. So everything from the actual quoting, supporting you as a broker up front, all the way through payroll management component once an employer is set up. Additionally, we have market-leading compensation for our broker partners when they're referring clients over. So next we'll dive into what does that end-to-end administration look like? So how does an employer actually help how does Savvy actually help an employer administer an ICHRA? So Savvy, we really position ourselves as that ICHRA or ICHRA back office. While ICHRA is designed to be simple, it can be complex. So we're here to make all the back end components operate much more seamlessly. And that includes everything from ICHRA setup and compliance to benefit administration, as well as plan navigation, carrier enrollments, customer support, and premium payment. So on the premium payment side, Savvy has a built-in payment feature that we'll go into more detail on to help ensure that those payments are able to easily process. So what are the steps for setting up an ICHRA? So Savvy really helps you, again, from that end-to-end experience, all the way at the beginning when you're just evaluating whether a prospect or a renewal might be a good fit for an ICHRA. So those steps include determining the fit. So Savvy's ICHRA analysis tools allow brokers to determine if a client could benefit from ICHRA by running affordability analysis for them, as well as creating benefit designs to help employers customize how they set their stipend with Savvy. Here on the right-hand side, you'll see kind of a screenshot of what that tool looks like. And we also have sample reports we can share you so you can see what that quoting and RFP reporting looks like. And then kind of leaning off of that, how can employers customize their stipend? So depending on a company's goal and their employees' demographic, they may want to customize it based on employee class. So one of the benefits of ICHRA that I kind of alluded to earlier is that employers can set classes. There are a range of classes available that you'll see listed here, everything from full-time and part-time, salary and hourly, to being able to differentiate the stipend by geography as well as like state by state. So as an example of what it would look like for an employer setting up ICHRA with classes, here is a employer that has multiple locations throughout the country. They use a group plan for their headquarters states, and then for the other states where employees are based, they can use an ICHRA. So when using classes, you can offer a group plan to one class and an ICHRA to another class. You just can't combine, you can't offer a group and an ICHRA to the same class. So these classes offer a lot of flexibility for employers as they're looking to design their benefit. And then kind of leaning off of there, what exactly does benefit administration look like for an employer? So ICHRA does a lot to remove the headache of offering benefits, but then Savvy's technology takes it a step further to further manage the back office component. So within our employer app that you as a broker would also have access to, employers can view employee summaries, as you'll see here in this screenshot. They can add and terminate employees, they can view plan documents, and they can also access account statements, all within this seamless dashboard. Once an employer actually invites an employee, we'll walk you through what that experience looks like. So an employee will receive their invitation to Savvy where they'll set up their account. And Savvy will guide them through a simple education and enrollment experience. Our best-in-class technology makes it easy for employees to find a plan that is best for their needs. They'll also have access to our customer support team throughout the process via our in-app chat. So here you'll see, I'll show the short clip of what that experience looks like. So again, once an employee is invited to Savvy, they'll create their account and they'll be guided through these 4 steps here that you see on the left-hand side. First, they'll add their personal details, add dependents, and then they'll be able to move forward to select their medical, dental, and vision benefits within the app. There are 2 different options when it comes to selecting medical insurance. They can either shop for a new plan within the app, or they can get reimbursed for an existing plan. If they have an existing qualified health plan, such as a Medicare plan, that they're already paying for, they'll simply input that premium amount, the plan name, and the carrier name, and testify that it's a qualified health plan. Our team will follow up asking for that documentation to ensure that the employer is compliant, and then we'll set up reimbursements through the employer's payroll for them. If an employee chooses to go and use the shop for your own medical plan option, they'll simply click that button and then they'll be able to see all the carriers and plans that are available in their area. They can sort, as you'll see on the left-hand side, by a variety of features. They can also compare up to 4 plans side by side. So say they've narrowed it down and are trying to make that final decision, they can see what those different options look like. So everything from the premium, deductible, out-of-pocket max, all side by side. And then once they select their plan, they'll see it accounted for over here on the right-hand side within their Savvy cart. If they owe anything, that'll also be reflected here. And then throughout this time, they can always chat with our customer service team, as you'll see here on the right-hand side, to ask any questions that they may have. And then once they've selected their medical plan, they'll be able to move forward, do the same with dental and vision. They can either shop for a new dental or vision plan or get reimbursed. They can also skip those selections altogether. And then once they've made all their selections, they'll simply review and submit their selections to Savvy. And then from there, depending on whether you as the broker wanted to do the enrollments or want Savvy to help you do the enrollments, those enrollments will be processed and they'll receive those ID cards from the carriers. And then, so from a payments perspective, how do payments in Savvy actually work? So as I mentioned, employees who are using that shop for your own feature within Savvy will be able to use what we call our Savvy benefits wallet. The employer will set up this Savvy benefits wallet and fund it during their onboarding process. Each individual employee will get their own individual card associated with this wallet that they can use to purchase their medical plans. You'll see those cards reflected here. It has both the debit card option as well as the e-check or ACH option, because each carrier kind of differs as to what payment options they allow. But once an employee is enrolled, they'll be able to set up auto payments with this payment card to ensure that all future payments are seamlessly withdrawn and paid for. And then if any, and this card will pay for the entire amount of their premium. So it looks very much so like traditional group health, where the employer pays for it all up front, and then anything outside of that employer contribution or stipend is withdrawn from their paycheck, and Savvy integrates with the employer's payroll to make sure that that differential is deducted. So again, I'll pause here before diving into our last section to see if there are any questions. All right, so it looks like there's one here. Does the employee lose the SEP if they get a tax credit from the marketplace? Yes, so in order to qualify for that ICHRA SEP and enroll mid-year, they actually do have to elect the ICHRA stipend. There are some brokers will design their ICHRA to be to have this stipend be intentionally unaffordable so that employees can waive their stipend and elect into the tax credit on the marketplace. But mid-year, unfortunately, you're not able to do that, given that the employee wouldn't have a SEP to opt into that tax credit with, unless they had another SEP outside of ICHRA. Looks like there, William might have a question. If you want to go ahead and ask it, feel free to unmute yourself.
Yeah, I was just curious, you might have covered it earlier, but if a employee is coming in and they already have an individual plan, can they put that individual plan into the ICHRA and get that partially covered?
Yes, so they'll be able to submit for reimbursement for that plan they're already enrolled in. And then we, instead of setting up deductions, since they've already paid for it and already enrolled in it, then we'll just set up reimbursement through the employer's payroll for them.
And would any plan qualify, or is there a limit to what would be covered?
It does have to be a qualified health plan, which we have kind of those parameters listed within our apps. They know what it looks like, but essentially anything that offers essential minimum coverage, most often those are plans that are available on the individual marketplace, or like a Medicare plan also falls into that category, as does like for dependents or students who are maybe also in school who are on their university plans, those qualify. Probably the category that gets asked most often that does not qualify is spouses plan. So spouses plans do not count as qualified health plans. So an employee can't submit their spouses plan for reimbursement. And that's largely due to IRS regulations. So when essentially, since both the spouse's employer and the employee's employer are getting tax advantages, it kind of like double dipping from a tax front.
Awesome, thank you.
Of course. Any other questions? Can LLCs offer ICHRAs? Yes, LLCs can offer ICHRAs. Alrighty. Well, I'll go ahead and dive into the next section around savvy broker partners. But again, feel free to stop and ask questions if you have any. So how does Savvy work with broker partners? So we really envision ourselves again as being that back office. We're here to support you. We know ICHRA is new, and we're really here just to enable you to get ICHRA in front of more of your clients and expand your business. We do really all that back end work so that you have that flexibility to focus on identifying those clients that are a right fit and building that relationship while we make all the other components work seamlessly for you. And kind of leading off of there, what can ICHRA mean for your business? So we've kind of bucketed into the two different categories. So if anyone here is purely focused as an individual broker, ICHRA allows you to really expand and grow your business and leverage your knowledge of the individual market to support businesses on offering group health insurance. And then for those that might be focused purely on the group side, it really is another tool in your tool belt for supporting your existing clients where ICHRA might be a better fit. It's also a time-saving tool. We hear many brokers say for their smaller groups, especially those with under 10 employees, that it is a lot of work to get those quotes for those group quotes for their small clients. And oftentimes there are participation rates or contribution requirements that actually make the employer not decide to go with those options. So with an ICHRA, it's easy to get those quotes and position it, and there aren't any of those requirements. And then lastly, it's also an affordable option for employers who are impacted by high renewal rates. So again, just an additional tool that allows you to better support clients. So what exactly does support from Savvy look like as a broker? So we really bucket the support that we offer in three different categories. The first being collateral, second being reporting, and then third being that ICHRA administration kind of umbrella of items that we have reviewed. From a collateral standpoint, we have a variety of broker education content that is there to help you as you're getting started with ICHRA and trying to understand how it might fit into your book of business. We also can provide marketing support. So we have some brokers where we're helping them run email campaigns to new prospects about ICHRA to get in front of them. And then also we have others where we're helping them run like Facebook ads or like LinkedIn ads to garner new business. So we're able to help support you in those areas. And then lastly, we also have employer and employee collateral. So as you have, as you're talking to these employers, you can share collateral with them that helps better explain how ICHRA works as well. And then on a reporting front, as I mentioned earlier, we have that ICHRA analysis tool that generates reports that allow you to help a client determine affordability, determine whether or not an ICHRA is a good fit for them by running savings analysis, comparing their current or quoted group plan against ICHRA. And then that tool also enables you to do benefit designs as well. And then lastly, you'll see here that ICHRA admin bucket. So everything from helping you with a shopping platform. So we have that shopping or quoting platform that you saw earlier. We can also do enrollment processing for you. Some brokers prefer to do it themselves, but we offer that flexibility if you want someone to do it for you. And then also plan documents and ICHRA notices. So we'll create both of those for the employer to ensure that they're compliant with their ICHRA. And then next, now you might be asking what do the clients look like, or what do the fees look like for clients, and how do I get paid as a broker? Savvy, as I mentioned earlier, really positions ourselves as a broker first platform. We value our broker partners and really align our commissions to make sure that it speaks to that component. So I'll first touch base on the client fees and then dive into the broker commissions. But you'll see from a client fee perspective, Savvy charges an annual platform fee of $2.99 and then a monthly subscription fee of $29 per enrolled employee per month. As a broker, you can also charge fees within the Savvy fees. If you want to charge any additional amounts, we can bill those for you and remit it with your referral fee that you're getting from Savvy. And then for broker commissions, it will vary depending on whether or not you do the enrollment or we do the enrollment. If Savvy does the enrollment, you'll get $2 per active employee per month from our subscription share. So from this $29 that we charge, plus we also pass along that insurance commission that we get from doing the enrollment. Given the actual insurance commission does vary carrier by carrier, we just do a flat commission of $15 per enrolled employee per month. Right now, we are offering a promotion through Q1 and Q2, where for any clients that you put with us in the next 2 quarters, you'll actually receive $29 per enrolled employee per month. And then as the last slide here, just so now that you've kind of got an overview of ICHRA, who Savvy is, and how we work with brokers, if you're ready to partner with Savvy, the next steps are just simply emailing Savvy. You can email us here at info@gosavvy.com or email me directly at hannah@gosavvy.com, and we'll set up a time to get started. We'll walk through our employer onboarding, our broker onboarding, where we essentially just confirm how you want Savvy to be configured to meet your agency needs and give you access to all that collateral, walk through how to do reporting. And then we can also host trainings for anyone that might be in your agency or on your team that wants to learn more about ICHRA. And then from there, you're able to start referring clients and getting them onboarded with ICHRA right away. So now I'll leave some time for Q&A again. So feel free again to raise your hand or just unmute yourself and ask any questions or add them to the chat box. Any questions? For anyone, I guess, who's...
I have a question.
Perfect.
Maybe you went over it, but you might review it. How long does the process generally take?
The process to onboard a client?
Notice from start to finish, if an agent has an interest in the group, they say it's a 10-1. They start on, what's the lead time? How long does it take to get implemented? All that kind of stuff.
Yeah, definitely. So from our brokers who have placed the most clients with ICHRA, they'd probably tell you they recommend like first positioning ICHRA like 3 to 6 months out from when the group is actually renewing, just so that they're familiar with it. They're not being introduced to it at the very last or tail end of the process. However, in terms of actual timeline, once you send us a census, we can generate a quote for you, usually in 1 to 2 business days. We generally will join the calls with you, the client, to answer any specific questions they have and support you. We don't have to, but we can. So kind of building a buffer in there for that. And then from there, once a client decides to go with ICHRA, we recommend them starting onboarding 6 weeks prior to when they want coverage to begin. So say they're looking at a May 1 start date, they would want to start onboarding with Savvy now. That onboarding process takes 1 to 2 days. It's just 4 steps, but we do set up that account during that time frame, so that it will take just a little bit of time to set that up. And then once it's set up, they can invite employees, and employees will have until April 10th to make their selections. The last date that an employer can onboard with Savvy for coverage first of the next month would be the 1st. So like for, again, that May 1 example, you'd have to have them onboarded by April 1 to actually be able to offer coverage May 1.
Thank you.
Mhm. And then the other question is, does it cost anything for an agent to get started with Savvy? No, we do not charge our agents or broker partners anything to use Savvy's quoting tools. So you're able to get started with $0 cost. We just recommend that you schedule that first onboarding call before sending over a census. That way we can give you access to all that content and you are better positioned when presenting the census. But that we make it very simple. Alrighty, well, I will follow up from this with a copy of this deck as well as some other content that we have. And then if anyone else would love to schedule that follow-up call and get started, we'd love to walk you through what those specifics look like and help support you and any clients that you feel might be a good fit for Savvy. But again, here's our contact information. You can email us at info@GoSavvy or at Hannah@GoSavvy, and we'll be happy to get that call scheduled. Thank you guys all for joining today. Hope you have a great rest of your day. Take care. Bye.
Thank
Thank you.
you.